Hello viewers, I am Dr. Somnath Garai from Bhagirathi, Neotia, Newtown. So today we are going to talk about heat related illness in children. So last few weeks we are experiencing extreme environmental temperature and heat waves, and whatever may be the cause, that this high temperature can cause heat related illness in vulnerable population, and we all know that children are most vulnerable population for heat related illness. So what is heat related illness? So when body cannot regulate temperature, and that gradually body temperature keeps on increasing, that can cause organ damage, and overall this is known as heat related illness. So if it is milder form, it is known as heat stress, but when it goes into the extreme form, that is altered sensorium and child become very sick, that is also known as heat stroke. So obviously we want to identify this heat stress. So what are the common signs and symptoms, and why children are more vulnerable? So when we expose to extreme environmental temperature, body tries to regulate the temperature by several mechanisms. Without going into the details, these mechanisms are not well established in children's body, and they cannot produce more sweat, their body surface area are more, they produce more body temperature, but so over ultimately they cannot regulate the body temperature, and that exposing to the high environmental temperature, that core temperature also keeps on increasing, and then that can cause this heat related illness. So what are the signs and symptoms? So heat stress, as I told, this milder form is known as heat stress. It can be mild symptoms like they become GD, their children become GD. They feel nausea. There will be vomiting. There will be heat cramps. Their heat related rashes can be there in the body, and in smaller children, they can be irritable. There will be excessive cry, etc. But when that goes into the severe form, there will be altered sensorium, there can be fits, there can be extreme body temperature more than 104 degree, not coming down with normal medications. So this is known as heat stroke. So how to prevent it? So to prevent heat related illness, UNICEF has started one campaign. This is known as Beat the Heat campaign. This is for general population. So what is beat the heat? This beat, be for be aware of the heat related illness. So we should know that this few months or heat waves will be there, so we'll be prepared for the heat related illness. E for early or easily recognize the signs and symptoms of heat related illness. A for we should act immediately, and T for take the child or vulnerable population to the nearby health facility whenever needed. So now what you will do as a parent, what we should do if we think that there is a heat related illness. So obviously the signs and symptoms I have explained, if those are there and there is a history of sun exposure, so probably we are dealing with in these months we probably were dealing with a heat related illness. So immediately take the child to the cool environment where you can switch on the AC or fan. We should remove the tight clothing, that is most important. And if there is fever or there is shivering also, sometimes parents used to cover them or wrap them, but try to avoid that, because that can again worsen the situation. We should do sponging, so cold water or normal temperature water, you can use the towel and cover them and do sponging, and try to hydrate them by giving sips of water and if possible ORS. But here we should remember that if they feel nauseated or there is vomiting, so do not forcefully give them water, oral water, give them small amount frequently, otherwise there will be vomiting and dehydration can be worsened. Next is prevention. How to prevent it? So few of the steps we should all know that excessive sun exposure should be avoided. So if possible, that we should avoid outdoor activity during this season, particularly that afternoon sun from 12 p.m. to 3 p.m. is the most dangerous time. So we should avoid those sun exposure, and if at all there is needed sun exposure, so we should use cap, we should use light cloth, like light cotton clothings, and most importantly hydration. So sips of water or a small amount of water frequently. So we ask them every 20 minutes at least they should take a break and take some water. And if the sun exposure duration is more than 1 hour, try to take some electrolyte solution like ORS, or even homemade sarbat is also fine. And obviously we should identify the severe symptoms, like if there is muscle cramp, there is less urine, there is giddiness or vomiting, then probably we are dealing with a heat stress, and we should identify them and start treating them and go to the nearby hospital.